for the meeting of the New York City Health and Hospital Equity, Diversity, Inclusion Committee. Today's meeting is officially called to order. Please note for the record, Dr. Allen is representing Dr. Katz, and Molly Wasser Park is present. Uh, Again, please note that for the record that Dr. Allen is representing Dr. Katz in voting capacity. Next on the agenda, I would like to propose a motion to adopt the minutes of the Equity, Diversity, and Inclusion Committee held on May 7th, 2024.
So moved.
So moved by Jackie.
Yes.
Thank you. But Dr. Pagan, Dr. Allen,
Approved.
Sally Hernandez Pinero, Jackie Rowe Adams, you said yes, and myself, yes. Thank you. Next, Dr. Allen would like to share with us.
Thank you very much. Just wanted to share with the board that earlier in August, at the meeting of the National Medical Association, which is an organization of African American physicians, H&H was represented at a booth for recruiting physicians into our pipeline to becoming providers at H&H. It was very well attended by H&H staff, and I wanted to just share that with the board. It's the first time that we had a booth actively recruited at the NMA convention.
Nice.
Thank you for sharing that. Next is a diversity and inclusion update from Evelise Mendez Justiniano.
Yes.
Okay.
Good afternoon, everyone. Today I will be presenting the diversity, equity, and inclusion updates, and then I am joined by Dr. Nicola Davis, who will be speaking on the Equity and Access Council, focusing on our Asian American and Pacific Islander inclusion groups. So as we provide a breakdown of year-to-date in terms of our training, from January 1st of 2024 to current, we had a total of 21,279 employees participate in the education and capacity building activities. Our top 5 were identifying, managing, and unconscious bias, religion as a social determinant of health and building psychological safety, Juneteenth, celebrating freedom, honoring ancestry, and Women's History Month, Women Mentors in the Workplace, and Black History Month, Keeping It Alive. And you can see the total number of completions respective to each training. And these are important just in terms of not only providing a sense of community for individuals, but also providing another level of awareness in each of these topics.
Are these virtual as well as in person?
A combination of both. So the identifying and managing unconscious bias, that is an e-learning module, and that's required for all new employees as well as existing employees. All the others are workshops, and those were held in a live format. And you can actually see the difference in terms of the completions when it's e-learning, and we can send that out to the system as a whole, versus when it's in person, it's a little bit of a smaller touch or a reach. In terms of language access, I'm happy to announce that we've made progress in our RFP for interpreter services. Our new interpretation contracts were approved by the CRC on April 16th and the board on July 25th. The new contracts will cover over-the-phone interpretation, video remote interpretation, on-site interpretation for spoken languages, on-site interpretation for sign language, language proficiency, and interpreter skills assessment. The new contracts are scheduled to start in Q4. The notable things about the new contract, something a little bit different and exciting to announce, is that the new contracts come with it with Epic integration, which means we're working with IT right now in terms of making it easier for our providers to access interpreters with the patient. So instead of having to call the interpreter, it's going to feature a button that you can press, and it will give you access to the interpreter, whether it's on video or whether it's on the phone. In addition to that, New York City Health and Hospitals has the largest usage by session volume of MyChart in non-English languages within the United States for both 2023 and year-to-date for 2024. So it just shows you the volume of usage that we have across the country and how how we stand out from all the other facilities. In terms of our veteran support focus, we have had a total of 162 participants engaged with our veteran pop-ups from November 2023 to present day. Our goal this year was to have a different pop-up at each acute site facility, and we are on track to meet that by the end of the year. So we held Bellevue August 22nd, South Brooklyn September 18th is scheduled, Elmhurst September 24th, and we have sessions scheduled through the ending of the year. In terms of what's offered during the pop-ups, the veterans are able to use start a VA claim, update military records, obtain copies of their military records, appeal VA decision, and learn about services available and more. One of the important things to know about the veteran support is that we started this by offering the veteran pop-ups to our employee population, and it's been so successful working with the CEOs in partnership, we've now expanded that to the community. So any patients that are have veteran status, they can come in and they can obtain that information from us. We also added a new veterans site on the Office of Diversity, Equity, and Inclusion webpage, which allows them one-touch access to any information that veterans may need. It links them to the appropriate services. We will be having a Veterans Fair on October 3rd at Gouverneur, and we will have a Veterans Day webinar in November in commemoration of Veterans Day. For our disability awareness focus, we have had sessions in July, August, and we have a scheduled session in September, October, November, and December. And so we've had pretty good participation. These are virtual live sessions. One of the highlights in terms of positive feedback, this is from one of our employees who stated not knowing that someone has a disability by their looks and also being more sympathetic and understanding of persons with disability as one of the insights that they gained from attending the workshop. In addition to this, we've been out doing a lot of outreach, a large amount of outreach with our community. And so we have participated and connected with over 100 individuals at the Disability Unite Festival on July 14th at Central Park. We also held a CODA training, which is Children of Deaf Adults, and a movie screening at Woodhall on July 29th as part of Disability Pride Month. We are participating in the New York City Disability Parade event on October 20th. And we're hosting what we're calling the Blind Experience Pilot at Queens Hospital on November 14th. And this session will basically be geared towards our employees, trying to understand and show them what it is like to be a blind patient coming into one of our facilities. In addition to that, we also have, we're in the process of scheduling adaptive yoga online for our disabled patients in December. Continuing on with our community outreach and our Pride events for LGBTQ+ equity, in June of 2024, we attended a total of 9 Pride events across all 5 boroughs, including the citywide New York City Pride Festival and March. The staff members tabled at 6 festivals with a total of 2,579 community members that we were able to connect with, which is an 8% increase on 2023. So when we attend these festivals and we march in these parades, we are giving out information about our services throughout the 5 boroughs for all of our New York City Health and Hospitals facilities, and we're engaging with potential patients as well as current patients. We also marched in 3 parades, the Queens Pride Parade, the Brooklyn Park Parade, and the New York City Pride March, which is the largest march in New York for Pride Month. In July and August of this year, we participated in TransFest on July 13th. We engaged with 117 community members. And on August 22nd, the team engaged with 40 community members with the Trans-Latins Network Health Fair. We also participated in the LGBTQ Leadership Roundtable held by the Mayor's Office on August 19th and the Mayor's Office of Immigrant Affairs Task Force on August 22nd. We sent out a number of Pride communications, Pride-focused communications. These included emails from Dr. Katz system-wide to our employees. We also had press releases to release Metropolitan's 200 gender affirming surgery. We had notable LGBTQ dates highlighted in our ODEI June newsletter that gets sent out to all of our staff. And we also had an article titled Did You Know?, which was information on the Stonewall uprising on our insider page. We also had, in terms of engagement with our community, we had on the social media page over 80 social media posts throughout the month of June. These included Facebook, Instagram, and LinkedIn, promoting all the activities that we were doing and how to join us. I'm also happy to release that we have a new insider homepage. So we have revamped our Office of Diversity, Equity, and Inclusion website. It is now much more user-friendly, and all the information that staff may want to access is there at their fingertips. Some of the things that you can do on the site is access the Essential Documents Resource Library, which is essentially consent forms and all other vital information translated into the top 13 languages. So this is at a touch. You can go in there, you can get access to the information, and then you can tap on the language that you would like. And then based on that language, you can print them out or use them accordingly. We also can register for education and capacity building sessions. So it's, again, at your fingertips. Any training that we offer, you can register directly from the website. You can access information on all the services offered, which include the veteran services, LGBTQ services, immigrant affairs, and everything that we have available under ODEI. You can also apply for our inclusion group, so we've made it much easier for any staff that's interested in applying for an inclusion group and joining an inclusion group. They can do it through this site. And it's also a place where we use to promote upcoming events for our staff. In communications and marketing, continued with that. On August 26, 20th, 24, we launched our Women's Equality Day campaign, where we photographed and interviewed women across different facilities, skill sets, and cultural backgrounds. And these were featured on the Women's Equality Day Empowered Women Empower Our City page. And it was a campaign across our social media channel and insider channels. In terms of awards, in May, Politics New York and AM New York awarded the American Association and Pacific Islander, the Asian American and Pacific Islander Power Players list. Our very own Dr. Long and Dr. Wei, as well as Dr. Chaudhry and Lena Benayon, received the recognition. In June, AM Metro, Politics New York, and Gay City News noted Dr. Mitchell Katz and Kevin Louie as 2024 LGBTQ Power Players. In August, Politics New York and AM New York Metros also noted myself and Carlos Cabrera as 2024 Power Players in Diversity, Equity, and Inclusion. And lastly, Brandon Hall Group Excellence Gold Award was awarded for the Best Learning Team. And our submission was actually the new model of interrelating all of the training we do and adding the DEI lens to the training that's being offered to staff. In community outreach, we've continued with that theme. We participated in the National Dominican Day Parade, so we have different facilities featured here. We have Gotham Health, Metropolitan Hospital, and this is basically celebrating the communities we serve and promoting the services offered by our system. We participated in several back-to-school health festivals, and we partnered with Metro Plus and different facilities, again, offering all of the diversity, equity, and inclusion services that we have available and really making that connection with our communities. Any questions?
Thank you. Any questions?
Yes.
Yes.
I just, on the disabled and veterans, curious if you know what percentage of our population of employees fits into those categories? And then two, how affirmatively do we recruit folks with disabilities or veterans?
So the first question, right now I can tell you, we know of about 200 plus employees who have self-disclosed. So we don't mandate when somebody is hired to disclose if they're a veteran or not. So it's basically on a self-disclosure. What we are finding is that as we start promoting veterans activities, we have veterans coming forward that are employees and saying, I want to participate. Another interesting fact is that we've also found family members, spouses, military spouses that work here, that when we start offering all of these services, they're coming to us and they're saying, thank you, this is something that we need, and sometimes bringing in their spouse who may or may not be an employee of New York City Health and Hospitals. So I think that that number in terms of self-disclosed is going to rise based on the marketing and based on the work that we're doing. We also have an inclusion group that's focused on veterans as well. So that's also going to help to build a sense of community for this individual population. And then the second question, there was another one?
Yeah, the second question is just, how affirmatively do we outreach for employment opportunities to the two communities?
So that's actually going to be part of my next report in the beginning of the year. We have a whole strategy around this, but we're going to be working with the talent acquisition team to focus on these communities. And there are different areas that we haven't necessarily tapped into yet that we look forward to tapping into that provide us with access to veterans that are looking for employment. So we're looking to expand on that as well.
So I want to go back to the training piece. I didn't see the timeline for that training. How long is the training?
Which training?
Um,
I can go back.
let's go back.
Did I not go back?
Yeah, it was like near the beginning. Yes.
All the workshops?
The workshop training. Yes.
The timeline for them or the length of them?
The length and the timeline. Yeah.
Okay, so the timeline is from January 1st to today. So it's the whole year.
You're saying it starts in January.
Oh, no. So what we're reporting is from the time that from January to now. So some of those trainings only occurred once, some
Okay.
occurred twice. On average, the workshops last maybe about an hour.
Yeah.
And it's simply because we're very mindful of taking staff away from the workspace. So generally, we try to do them as lunch and learn sessions so that the majority of employees can avail themselves of them.
Oh, okay.
Are any of them online, Ivy?
Yes, identifying and managing unconscious biases online. What we've done when we teach DEI topics, those are generally more touch and feel and making and establishing connections. So what we've done is we've tried to have a hybrid where when we definitely know that creating a virtual environment gets us more representation, gets us more people attending. So what we do now is we have live virtual led instead of in person. So for example, if I have a training here, I may be able to fit everyone around the room. If I have a training on a virtual, it can still be a live person. We can still have breakout sessions, but I may be able to accommodate 100, 200 individuals. So we've been leaning towards that.
Thank you. Jose
Uh,
Pagan, any questions?
Just a quick comment on the VA, on the pop-ups. You mentioned a set of services, and I was just curious to see which ones were the most popular or the main reason they go there.
So one of the most popular ones is to see their VA benefits, so their disability rating. And so what we found, and so I can't disclose because that's personal to the veterans, but what we found is that a large majority of the veterans that are engaging in these sessions walk away having the ability to now approach their disability rating, put the order in, put the form in, and be able to get the monies that they are entitled to based on their disability rating. So some people don't even know that, hey, people assume that sometimes because they're working, they don't have access or they're not eligible for a disability rating from the military. And so by partnering up with the Mayor's Office of Veterans Affairs, we have individuals that come in, give them that information, and really expose them to a whole variety of services that they didn't know. I can tell you personally, I'm a military spouse, and so I was not aware that I have access to free burial. And so I'm like, oh, okay. So this is advanced planning as well. And I learned it myself through one of these sessions. So every time I learn something new.
Thank you.
So for me, congratulations on being named a 2024 Power Player for DEI. Thank you. We often enjoy your presentations. And
And
thank
I will
you.
turn it over to Dr. Davis.
Thank you.
You're a pediatrician. This is your pop. Aren't you a pediatrician? Oh, I thought you were. Diversity of age at the meeting.
Of course.
Great, so I'm just gonna provide some updates on the Equity and Access Council. So just as a reminder, these are the 4 pillars of the Equity and Access Council. And today we're gonna be focused on workplace inclusion. Natalia normally presents on the inclusion group, but she's unable to be here today, so I'll be presenting in her stead. So these are our 14 inclusion groups. The last time we presented here, there were a few of them that hadn't quite been formed yet. So our more recent groups are our Jewish inclusion group, which is now fully formed. I think the last time we presented, these were in progress. So our Jewish inclusion group is now fully formed. We also have a Hispanic Latinx physicians group, which is relatively new. They've just had a kickoff meeting, but there's more to come there. And we have a Muslim inclusion group that's also recently formed and is scheduled to have their kickoff meeting in September. So today we'll be hearing from the Asian American Pacific Islander inclusion group. And so we're joined by 2 of our colleagues from our facilities. They are the co-leads for this inclusion group. We have John Balduin.
Yeah, that's right.
Did I pronounce it right? Okay, great. From Gotham Health, and Winnie Wong from Kings County. And I'll turn it over to them to talk about the activities of this group.
Oh, thanks. Hi, thanks for having us. So I'm John Buen. I'm the Associate Director of Quality Management at Gotham Health, and Winnie Wong.
I'm licensed creative arts therapist, dance and movement therapy at Kings County Behavioral Health.
And we're the co-leads for the Asian American Pacific Islander group, API group. Yeah, thank you for having us. We started, when we were called to start this group, I think one of the first things that's important is what is the identity of this group? What are we aiming to achieve? And so the members in this group and us, we worked together to develop our group goal that was to create an inclusive workspace that will make API members feel heard and respected. And this was developed with the team over several months, different drafts of what we're going to be focusing on, what we're going to work on. And we finally came to this group goal. How were we going to get there? These were our group objectives. That was to stand in solidarity with other NYC H&H groups against structural racism, societal inequity, and work towards non-judgmental safe space where everyone can fully show up. We wanted everyone who came to this group to be able to speak their emotions and to be heard and respected. We wanted to also collaborate with other AAPI groups throughout New York City health and hospital facilities and increase the awareness of these current API issues. It was our understanding that there were other hospitals that had their own homegrown sort of API-focused teams, and we wanted to connect with them as well. We want to increase understanding of API diversity. That was one of the sort of focuses that this group wanted to work on, and also advocate for all API community members. So one of the things that we wanted to, that was required of our inclusion group was that we were going to have some sort of engagement opportunity with staff members. So the team had developed a plan of what sort of projects we were going to work on. Was it going to be an educational opportunity, or an opportunity to talk about microaggressions, and an opportunity to talk about healing within the workspace. So our first workshop had occurred in June 22, 2023. This is actually a flyer that was developed with the API members, and it was facilitated by Lily Wong. Our speakers for this group included Lily Divino. She's the Director of Adolescent Health, and also Ariba Tariq. She's a data analyst from the Office of Ambulatory Care and Population Health. They are our they are our API group members, and we were so blessed to have folks within our group to be able to talk about this topic. And the learning objectives that um, folks were able to gather from this workshop were that they were able to learn factors influencing API identity in the United States. Participants were able to walk away from this workshop learning to recognize the diverse characteristics among API patients within New York City Health and hospitals that influence their health outcomes and healthcare. And also, our participants reflected or were able to reflect on how API identity impacted our New York City employees. And I'll pass it over to Winnie.
Thank you,
Talk about
John. Yeah, so with our workshops, with education, microaggressions, biases, the experiences of AAPI community members here at H&H, and then a healing workshop. The group members also identified a good, meaningful progression of first who is AAPI, what's the experience, and then thirdly, the healing workshop. So the next one in our second workshop in May 2024 for AAPI Heritage Month, we got very lucky again. Teresa Doherty, who is very close friends with Dr. Kevin Nadal, won I think she did like a silent auction and won a reward of a free 1 hour talk with Dr. Kevin Nadal. And she very gratefully gifted it to the AAPI Inclusion Group. So we once again had an in-house resource that we tapped into, which was really great. His research and wealth and depth of knowledge is on API microaggressions, biases, also LGBTQ plus intersection, and how that affects mental health. So it was actually a very, I mean, I think he could have done 2 hours, but we had 1 hour for free. So participants there were able to learn how to articulate their multiple identities influenced by their values, biases, attitudes, assumptions, behaviors, and general experience of the world, and of course how that shows up at the workplace. Describe their types of microaggressions that maybe they experience and feel and or don't know that they're feeling it, and how to identify that. And so the negative impacts of that and how that has impacts on people and groups, and then of course how that translates to our patient care. And then the bottom, discuss culturally competent and effective intervention strategies in working with others of diverse backgrounds. How does that play into teams, coworkers, and also patient care? So we will have, and I'll talk about it in a few minutes, a third workshop of the healing workshop that we'll revisit hopefully next year. So the group really identified their monthly meeting space to be functional, getting these webinars identified, fleshed out, etc. But also they really wanted a need and ask and call for half support space. So every month, and tomorrow will actually be our next monthly meeting. We always do a check-in, see if anything wants to bring anything to the monthly meeting, ask the group members for support, what have you, and then we move on to the agenda. And we have had some people bring some experiences from their hospital sites and or teams, and we're able to process it and give some support in that. So the other thing that the group identified that they wanted were, especially about spring, summer last year, as weather was getting good, and asking for, can we have in-person outings and meetups and networking events? So again, Teresa has it in with the mayor's office and has extended us an invite 2 years in a row to the AAPI Heritage Month celebration at the mayor's Gracie Mansion event. So that's us from last year, and we got on the insider page. And then here are a few more pictures. So that was our first year at Gracie Mansion. And you see Teresa also had some leftover sunglasses from test and trace from COVID that we were like, how do we identify each other? If you've been to an event at Gracie Mansion, it's quite crowded. So we wanted a way to represent H&H and find each other. And then some of our networking events we've done off-site after work, and our next one actually will be next Thursday. We've had group members identify food and culinary aspects as a really rich part of the cultural experience, and how do we tap into that as coworkers? So we've been to mid-Manhattan, lower Manhattan, Queens so far. So we've gone to a few restaurants. The first one on the left, Cultural Food Tasting 2023, is in Queens, and then that one is in July, and that's with Alice Ho and Angie Bartarba, who's with Metro Plus. I'm meeting someone today, actually, who works here at 50 Water Street, so we're gonna connect, and then our next one is next Thursday. So our last, or third workshop coming up, there was discussion around, well, for this community, what does healing mean? Also, as we talk about working with clients in patient care, when we say healing, medicine, treatment, how do we define that? What does that mean? It could be received differently by different cultures and families. So the group discussed about healing could also include familial, traditional, homeopathic remedies and things that are passed down generationally. And so we're still in preliminary brainstorming stage for this workshop, but some of the target things we've talked about are the education awareness around that, different aspects of healing, including emotional, mental, physical, and spiritual, the empowerment to identify what's healing for oneself or one's family or cultural experience. So providing hopefully knowledge and tools to take control of your healing journey and improve your overall well-being. And then that transformation in terms of growth and how do you identify that for yourself, apply it for yourself, and then in terms of speaking as employees, then also apply it to your work with each other in patient care. So transformation, encouraging participants to move towards a greater balance, harmony, and health. And I do also want to just mention the group has identified wanting to create a group logo. And I don't know if any of the other inclusion groups have gone this route, but we have Lily Davino, who has a history in art therapy and does her own art and design on the side. She stepped up and was like, yes, I want to spearhead this. So I mentioned Alice and Angie. They're in their second iteration of drafts of logos. We are staying within H&H standards and color themes. And we'll pass it on to you, Natalia, when we have like final versions to get reviewed and approved. But we're hoping, I mentioned the sunglasses, we want to make something that is identifiable, visible. When we're out in community events, we can spot each other, but also at system-wide in all of our sites, literally, physically, and symbolically raise our voices and our representation in a really physical, visual way. Thank you.
Thank you. Dr. Pragan, any questions?
Just to say that sounds like a great initiative and group, and the fact that you're able to cover so many different areas from supporting each other to supporting our patients and creating a community and all the outings and foods and all that stuff. It's just the kind of it's important, yeah, to create that community sense. So.
Yeah, I think too for staff connections, staff wellness, it's important to get off your job sites often, how do you get out of the workspace sometimes and see each other in a different light and connect in that way too.
Thank you. Dr. Allen, any comments?
Yeah, I do. So really good work. I'm glad that you found each other.
Thank you.
But listening to describing your description of things that you've done for each other, and the purpose of affinity groups is to really support each other within your community. Are there any opportunities to share your culture and the lessons that you're learning about each other, to share it outside of your affinity group? And when do we do that kind of cross-pollination?
Yeah. Maybe the leads meeting group, I think this happens maybe once every couple months or once a quarter, where leads from different inclusion groups come together to talk about what have we been working on, what's been working with their group, and what can we adopt in our group. I'll give one example. I think it is in our workshop, or the webinar workshops, we had the idea of, well, how are we going to sort of get feedback from our participants on what they thought about the workshop. What could we do next time? And we brought that up during our leads meeting, and they were like, "Yeah, that's a really good idea. Let's standardize actually some questions, so that when anyone comes to our workshops, we know what they're walking away with, what we can do differently next time, and what we should continue doing."
And aside from process, I think here at H&H, we're so diverse that we could actually learn about other cultures. And I think the education, what I could learn from you, what we can learn from the Pride groups, et cetera, the African Caribbean groups, how do we, because it'll enhance our ability to take care of our patients, not just patients that look like me,
Right.
but if I'm taking care of a patient that looks like you, how am I informed, better informed?
Right, and take care of each other.
Yeah.
Yeah, in some of our brainstorming, we've talked about, and you know, when the time comes in our targeted timeline, maybe we've had to scale it back a little bit, but we've talked about wanting to do like, maybe here at central office, someone recommended like a potluck or some kind of performance. We got really lucky this past May with Dr. Kevin Nadal, so we were like, let's do this, and then we'll keep that on, you know, on the back burner. But also, we've talked about trying to link up with, because we know Elmhurst Hospital has a very strong and very, you know, annual, well, it came back after pandemic and lockdown opening up, but trying to see if we could maybe get a table with Elmhurst AAPI Heritage Month activities and kind of extend and broaden a little bit. So there's talk of that. It's, of course, we're a small but mighty group in terms of monthly activities. So it always has to come down to like, what can we get achievable?
Yeah. Thank
So
you.
I did want to mention too, I know we have recordings of our webinars. I would love to see all of our archived recordings get ratified for continuing education. And then that way, when we get to the place where people can access them, that the evaluations are set up and there's a way to receive a credit. And then that way people can also access them and have that cross education as
Yeah,
well.
great. Thank you.
Yeah, thank you for that. Sally Hernandez-Pinero?
Quickly, we often talk about how cultural differences in patients make a difference in terms of how we should approach them, what our expectations should be. And I guess it's Dr. Katz who often talks about the stoicism of Asian American PI patients, not having to be drawn out more to actually talk about what their issues are. So hopefully, as you look at the patient side of the issue, that those are learnings that we could share more broadly.
Yeah, thank you. Jackie Rowe Adams, any comments? For myself, I just want to say what an excellent job you guys are doing as a group. Often when these groups form, people feel like, oh, more work to do, right? But it seems that in this case, you've taken true ownership of it. And I agree with Dr. Allen, whatever you can do to share the methods that you're using. When you brought up the healing session, like every group that gets together always have, for lack of a better term, a complaint session. But to have a healing session, I think is awesome. So congratulations for all you've done, and we look forward to hearing more of the work that you're accomplishing.
Thank you.
Thank you.
Thank you. Any old business? Any new business? There being no further discussion? Yes, hi.
I'm a physician. I work for the health and hospital system. I've been employed since 2019 at health and hospitals.
So I'm sorry, I'm going to have to ask you to stop. Give me 1 second. This is the Equity, Diversity, and Inclusion,
Yeah, I know.
and
I came.
I believe there is a process for getting on.
Oh, it said it was a public meeting. And there was
It's
time
open to the public, that is correct. However, there is a process, and our chief of staff is right there. Maybe she can help you with that.
Okay, well, my last day of work is 9/18, which is in like 7 days or something. I was laid off when I was 37 weeks pregnant, and I've been trying to get in touch with the Equity and Access Council.
I am sorry, I'm going to have to.
Okay, well, your body seems to do work at the systems level, but the system is made up of thousands of individuals. I'm a minority physician. I represent a lot of
I
intersectional
am going to ask you to
identities.
please discontinue speaking for now. I'm
Okay,
going to
well-
have to, there'll be no further discussion. Meeting adjourned. Thank
Okay,
you.
well, I hope I,
This meeting is no longer being recorded.